Currently, NICE recommends that women under the age of 40 should be offered 3 cycles of IVF funded by the NHS if they meet the correct criteria, such as having been trying for a baby for a set amount of time or having had previously unsuccessful treatments. However, different clinical commissioning groups may fund at different ages, leading to variation across the UK and what has been deemed a postcode lottery for fertility treatment. Intrauterine insemination, IUI, or IVF with intracytoplasmic sperm injection, ICSI, or the use of donor sperm or eggs may also be offered. IVF involves the removal of an egg from the ovaries and its subsequent fertilization in a laboratory. The natural cycle is suppressed before the supply of eggs is boosted through the use of medication. An ultrasound scan is then used to monitor the maturation of the eggs, which are then removed when ready and fertilized in vitro. Finally, 1 or 2 fertilized embryos are then replaced in the womb. IUI is offered if the patient is unable to have vaginal sex due to disability or a psychosexual problem, if they have a condition which makes it impossible for them to conceive, like HIV, which prevents them from having safe, unprotected sex, or if they are in a same-sex relationship and they have already failed to become pregnant after 6 IUI cycles using donor sperm. ICSI, which is essentially injecting sperm into an egg, may be offered on the NHS if necessary. Normally, if the male sperm is of generally low quality, for example it has low motility, if the sperm sample that has been collected is of low quality due to normal variation in the quality of sperm, or if previous IVF attempts have failed. The success rate of IVF changes significantly based on the age of the patient. It is around 29% for women under 35, but only 9% for women aged 40 to 42. The risks of IVF include multiple births, premature delivery and low birth weight, ovarian hyperstimulation syndrome, which gives swollen or painful ovaries, along with the higher rate of miscarriage that is present for older women who get pregnant. Whether or not the NHS should offer IVF has always been hotly contested. Clearly, for couples that are infertile or have significantly reduced fertility, it is crucial. But for others, it might seem an inefficient allocation of limited resources. We can divide the reasons for and against by the relevant pillar of medical ethics. Patient autonomy would seem to indicate that reproductive assistance being available on the NHS is correct. Patients should have the right to choose whether they would like to start a family and when. Looking at beneficence, then certainly giving patients the chance to start a family would be beneficial to their psychological health. However, older women are far more likely to have problems during pregnancy, and their fetus is also more likely to have complications. In the interests of the greatest good for as many people as possible, justice, we might say that offering treatment is a positive, as otherwise only the rich could afford it, which would create an unfair landscape. However, by offering funding, we take away money which could be used elsewhere in the NHS. What do you know about assisted reproduction? What kind of help can couples with fertility issues receive from the NHS? Should IVF be offered on the NHS? What are the arguments for and against IVF being offered on the NHS? Can you tell us what happens during the process of IVF? What type of patient is most likely to have successful treatment? If IVF fails, are there further options that may be tried? Are there any risks associated with IVF? This topic requires you to have a knowledge of the different types of treatment and who they might be suitable for, as well as the risks of treatment. When you understand these areas, you can formulate your response to the ethical question of whether assisted reproduction should be offered for free by the NHS. When answering an ethical question on this topic, make sure you give a balanced viewpoint which considers both the psychological well-being of the couple who want to start a family and the need to direct NHS resources in a way that provides quality of life for as many citizens as possible. This topic can be referred to when discussing NHS funding, private versus public healthcare, and changes in healthcare and what people expect to be provided for them over the last 40 years. IVF was first successfully performed in 1977 and ICSI in 1991.